Hello, welcome to Medical Lab Science Quick Review. Did you know that several important immunodeficiencies are genetic defects along these key molecules in hematopoiesis? Our ACP Board of Certification Study Guide asks about several key immunodeficiencies. Let's look at hematopoiesis where these genetic defects can occur. For this topic, let's look at hematopoiesis from a different perspective. This second perspective of the lineage tree shows a condensed form of myelopoiesis. And we've expanded the lineage tree to include lymphopoiesis, as we've seen in our other video entitled More Immune Concepts for the Clinical Lab, which is helpful if you need more details. The T helper cells play a critical role in our immune system, activating, directing, promoting, and helping other immune systems through cytokine secretion. And just for your information only, direct B cell activation and clonal expansion through the interaction of T cell receptors on CD4 positive T cells with T dependent antigens and B cell CD40 and CD40L complexes. This direct interaction plus cytokine stimulation leads to plasma B cell expansion in the bone marrow and spleen to become tiny monoclonal antibody producing factories. Selected key immunodeficiencies. Please note, we'll focus mainly on B cell, humoral T cell, and granulocyte deficiencies that are on our ACP study guide. What can cause this genetic defect? Chronic granulomatous disease is an X-linked or autosomal recessive disorder of neutrophils, causing an inability to perform an oxidative burst with myeloperoxidase to convert hydrogen peroxide to hypochlorite for microbiocidal function. A myeloperoxidase enzyme in azurophilic granules of neutrophils and to a lesser extent in monocytes and macrophages combine a chloride anion to hydrogen peroxide, forming hypochlorite, which is similar to bleach, and it is another microbe killing chemical. Unfortunately, in CGD, phagocytes have an inability to kill bacteria and fungus, leading to multiple and frequent childhood infections. Recurrent infections are often severe, suppurative, and pyogenic, such as pneumonia, dermatitis, osteomyelitis, liver abscesses, gastrointestinal, and genitourinary infections are common. CGD often presents with dermatitis with these skin granulomas in the child, with raised, painful skin lesions with pinkish, reddish, or purplish hues with dark, collar like discolorations around the skin bumps. Catalase positive microorganisms such as Staph aureus often go unchecked. Likewise, nocardia and fungal infections with aspergillus often lead to a fatal pulmonary outcome. For more details, please see our other video on this fascinating topic. Abnormal neutrophil function can be measured using flow cytometry using dihydrorhodamine fluorescent dye, which will fluoresce when reduced by normal neutrophil activity, or the old classic nitro blue tetrazolium yellow dye test, which detects normal neutrophil activity to turn the dye to a formazan blue color in the peripheral blood smear. Note the genetic defect affecting neutrophils and natural killer cells. Higashi syndrome is a rare autosomal recessive disorder seen in children and young adults, associated with albinism and frequent severe pyogenic infections. Peripheral blood smear demonstrates huge lysosomal granules in their neutrophils, also monocytes and lymphocytes. The large abnormal lysosomes do not develop, hampering neutrophils with impaired chemotaxis and delayed bacterial killing. Wiskott-Aldrich and DeGeorge syndrome were both T-cell immunodeficiencies mentioned in our AACP study guide. Which one is associated with thrombocytopenia and eczema? Wiskott-Aldrich syndrome. Ataxia telangiectasia. It's a T-cell defect with immunodeficiency, poor muscle coordination, and red or purple skin rash with spider patterns. Ataxia means loss of full control of body movements. Telangiectasia means dilatation of capillaries, appearing spidery small red or purple clusters. Bruton's agammaglobulinemia, also called Bruton's tyrosine kinase deficiency. It's marked by all antibody isotypes are reduced because of a lack of common lymphoid progenitor cell differentiation to the immature B cell. So there's a severe lack of plasma B cells and antibodies. Bacterial infections begin soon in infancy after maternal antibodies clear. Almost exclusively, boys are affected since it is X linked. And as you can predict, there is a severe lack of CD19 positive B cells, and plasma cells are also decreased. Older tests, such as serum protein electrophoresis and immunofixation, may be helpful to screen and detect A gamma globulinemia. Modern diagnostic testing includes flow cytometry and molecular genetic testing. Selective IgA deficiency, the most common congenital immunoglobulin deficiency. Most are asymptomatic, but those with symptoms are suffering from respiratory and GI infections, as you might predict, because IgA is found mainly in secretions. IgA deficiency is also associated with type 1 hypersensitivity in blood bank when IgA deficient individuals receive plasma with IgA. Anaphylactic shock can ensue. These individuals are recommended to wear a medical bracelet so that they can receive modified blood products that are IgA deficient. Isolated subclass IgG deficiency. Suspicion arises when the total IgG is diminished, and diagnosis is obtained when clinical history of recurrent infections is combined with one or more of the four IgG subclasses, and it is deficient by at least two standard deviations below the mean. Thank you for your time, attention, and support, and we hope to see you in the next video.